6, and I'm very appreciative of your time. As you would expect, others may trickle in. If you haven't signed the sign-in sheet, if you could, as you know, when you apply for grants and you hold these community conversations, it's important to get a sense for how many people joined us tonight, because we'll build that into the grant application. My name is Jerry Kerr. I'm the Chief Executive Officer here at the Lewis County General Hospital, and tonight we're going to talk to you about what I think is a very exciting initiative. Joining me as part of this dialogue, this conversation, will be Michelle Prince, our Chief Operating Officer. But I'd like to just point out a couple little sayings that I have right here on the wall. These are things that I have tacked up all over my office, and I think they're important to remember as we talk about tonight's initiative. Do not give your past the power to define your future. We should define our future by what's before us. 2, a challenge, an opportunity to be creative. So we have a challenge. We're presenting this dialogue as our example of a way of being creative. I have another little sticky that I stick on the wall. It's called Welcome Change. This is change, so we should welcome it. And then lastly, I commented on this back at the end of July when Mike Young introduced me to the community. This is FDR in his second term. I never forgot that I live in a house owned by all the American people and that I have been given their trust. When you're the chief executive of a municipally held organization, this fits beautifully. This isn't my hospital, it's not Michelle's. We are stewards of the people of Lewis County, and part of our responsibility is to hold that in a sacred place and then hopefully drive good change so that we are a relevant and meaningful institution for the next generation. And that is a framework which we can all understand, because the next generation, they are your children and grandchildren. And I think it allows us to conceptualize it. Before I go on, I'd just like to acknowledge the Board of Legislators who are here. If you could just raise your hand so your neighbors can see who you are. Great, thank you, gentlemen. And we have some Board of Managers here. If you could raise your hands. Great, thank you all for being here. So, we have a grant opportunity, and tonight is a community engagement session. So we can lay it out to you, and we can hear from you. And what we want to hear is what you liked. If there are some things you don't like, we want to hear about that. But if you think we're missing something, what are we missing? So that's the goal. All right, Michelle, first task for tonight. Which button? Okay.
You have to aim at the projector. You have to aim.
Oh, we're aiming it at the wrong thing. There we go. All right, thank you. Okay, so when pursuing the such an initiative, especially the size and scope, we have to test it against our vision and mission. And so to start our presentation tonight, our vision, which was endorsed by the Board of Managers as well as the Board of Legislators, the communities of Lewis County are the healthiest in New York State and in America. That's an achievable goal as measured against the Wisconsin County Index. So in a few years, I hope that we can report that we are achieving that level of health in Lewis County. Our mission, this is the stuff that drives us every single day. Lewis County Health System is committed to working cooperatively with interested individuals and organizations in helping the people of Lewis County and surrounding communities in achieving their highest level of health and wellness. That's an important mission, and I think it reminds us, in this case, we will have many partners if we are successful with this initiative, and a principal partner would be the state of New York in helping fund this initiative. So the New York State Department of Health is currently accepting applications for the statewide healthcare facility transformation program 2. The reason we have that written down is it'd be impossible to remember otherwise. They have pledged, the state government, $204 million to strengthen and protect continued access to healthcare services in communities across the state of New York. So when we first became aware of this, it's like, well, why not us? So, an important question to ask, is the organizational vision and mission aligned with the goals of the grant? And the answer is yes. And if the answer was no, then I would be completely wasting your time tonight. So what are the grant goals? The goal of the grant is provide capital to support transformational change, transformation activities to help us get to the next level of where we need to be. The days of the traditional hospital are no longer viable, so we have to reshape the organization. So our goal, or one of the grant goals, is to support strengthening and protecting continued access to local healthcare services in Lewis County. Okay, we are probably 10 years lacking in major capital investment in this building, and also a committed approach to recruiting physicians, advanced practitioners, and they are nurse practitioners and PAs, nurses and technicians. We have an aging workforce and we have an aging building. So part of transforming this organization is to better position us to recruit these individuals, as well as modernizing the physical plant. Our plant, the average age of life right now is about 18 and a half years. It should be something closer to 11. What that speaks to is the lack of capital investment over time. And then we need to assure that we create a financially sustainable system of care. So in order to do that, we need to increase access for local surgical care. Another way to think of it is to keep local healthcare dollars local and not send everything to Syracuse. Okay? Enhance the patient experience. So these grant dollars will allow us to address these principal goals and enhance the patient experience. If you are up on Med-Surg right now, which is the East Wing, and you have to go to the bathroom, you have to go out into a hallway and find one of 4 available bathrooms. When was the last time you went to any public building, healthcare, and the bathroom wasn't part of your room? I mean, when I speak we're 10 years behind, that's an example. Healthcare has had private bathrooms in their medical surgical rooms for a very long time. That's where we need to go. Very simple, but that's part of enhancing the patient experience. So I think this is a great picture of the original structure. In one of our hallways, there's some history. It's a beautiful building. So in 1931, this building was constructed. It's spectacular. And on the wall, on that side of the room, you can sort of follow the history of the construction of the properties here. In 1963, the East Wing was added. In 1973, the residential healthcare facility was added. 1980, the emergency department underwent a substantive renovation. 1990, this building was built. In fact, we have some ideas about this building and we'll be pursuing some other grants for that. 2004, the children's building was added. 2005, a significant radiology expansion. 2007, the emergency department was expanded yet again. However, since 2007, there hasn't been a substantial capital investment in this building. Okay. In healthcare terms, 2007 to 2018 is a very long period of time. And that's why our average age of plant now is 18 and a half years old. So, what is our conceptual plan? From the bird's eye, this is what our campus looks like. So we're really talking about 2 projects. We're talking about Focus Area A, which is actually construction of a new plant, 36,000 square feet, and Focus Area B, the East Wing, and the ICU being renovated. Okay, And that's also reflected here. Okay. So we thought we'd talk a little bit about the conceptual design for both A and B. So focus area A is 36,000 square foot expansion on the hospital main campus. Convenient indoor access to and from the hospital, easily accessible from the number 3 road. Designated parking area located close to the entrance of that structure. And we're going to pursue LEED. It's the designation if you're a good steward of the natural resources, so leadership in energy and environmental design certification. In this new building, we will focus our outpatient services and surgical pavilion. So we're going to build 3 state-of-the-art operating suites. Right now we have 2 operating rooms circa 1931. Though they have been updated over time, we are grandfathered in many of the codes associated with those rooms. So that's why this is a principal driver of this initiative. We're also going to add a minor procedure room, basically an endoscopy suite where the colonoscopies would be done. That's probably the easiest way to think about it. We're going to increase the preoperative beds to 8. If you've had any work, clinical work done here, you know that you are prepared down this hallway opposite of the OR, and then you're wheeled around the corner, down a hall, through another set of doors, going by a few waiting rooms and a couple of elevators. So it'll all be contained within the surgical suite. We're going to add 6 PACU beds, the post-anesthesia care beds. So after your procedure, you'll be near the room, you'll be near the doctors, and you'll be close to where you need to be once your procedure is done. We're going to improve our space utilization. What that really means is we're going to eliminate items in the hallway. And you'll see some pictures in a few minutes that speak to that. We're going to enhance the separation between sterile and non-sterile areas, and you can appreciate in a surgical environment that's very important. We're going to have direct access from the OBGYN or birthing unit to the OR. For any of you who have delivered in this hospital, if you needed a C-section, you were in a stretcher and went down quite a length of hallway before you arrived at the OR. And then we're going to enhance privacy for all of the patients who are using the service. So patients will not have to traverse long corridors passing by communal waiting rooms. So that'll be the top level. The lower level, we're going to relocate our adult day center program, which is currently sort of in the bowels of the building between the back side of the cafeteria and the front side of the laundry. There's no direct access to the outside. There are a couple of windows where you can look outside and see mechanicals. So we would reorganize the program, and I think most importantly, to being a state-of-the-art space, we'd be able to increase the numbers that we could serve in that program. And as most of you know here, adult day health programming allows people to stay at home longer. So this notion of aging in place. And then we'd have designated parking for that space. In addition, we would look to build a behavioral health suite there, a dedicated space for behavioral health, and something we're calling the Health Education Center, basically community rooms where members of our community could come in and use these rooms and have more access to health education. So that's what we're thinking about there. The other part of the plan that's evolved since meeting with the medical staff and the Board of Managers is relocating our walk-in clinic, which is located currently in this building, and it's only open late afternoons into the evening, Monday through Friday. Our goal would be to have a walk-in clinic open 7 days a week, just sort of down the hall, if you will, from the emergency department, so to give folks a real option rather than go to the emergency department if not needed. So this is what the space would look like. So this is the entrance from OB. And so if you're in the main lobby of the hospital, it's out that direction towards that stand of tall pine trees. That's where it would be directionally. Okay, and you can see coming in right from the OB. It would have its own entrance. So this entrance is facing the number 3 road. And you can see we have the preoperative and PACU area. We have our waiting rooms, reception. We have the endoscopy suite in the 3 ORs, central sterile. And you access this from this hallway, which brings you directly into the hospital, from OB, or from outside if it's day surgery. You go through your preoperative process, and then you're able to enter the OR suite. There's been a lot of work previously to this grant by the management team and the medical staff, and really thinking through the placement of the rooms, the closets, the walls, the waiting areas, that sort of thing. So a lot of impressive work by the staff, regular staff and medical staff. And so this is sort of what we're thinking about for the lower level. This is facing the back parking lot, or the parking lot that is up Route 26. Okay, would be the adult day health program, and then the education center, behavioral health, and the walk-in clinic. And then this would allow you access to the main hospital. So at this point, I'm going to hand it over to Michelle. She knows the existing space incredibly well, and give her an opportunity to speak.
So, as Jerry said, right now, the space, if you're having surgery, you start off getting all your pre-op work done on the opposite side of the operating room. So you start off on one side of the hospital, and as you can see, the corridors, we have stretchers in them. We just don't have a lot of room. The facility is very, very clean. Our environmental services staff does a wonderful job, but there's just limited space to put things. And then once you get to the operating rooms, again, you can see there's a lot of items in the hallways because we do not have the room to store things. More pictures of the operating rooms, the scrub sinks, and then the actual operating room with the table. And then this is the post-op area where you have the nurses station. You have some workstation for the nurses, and then the patient stretchers with you right here. And we don't have a lot of room. I think there's like room for 3, which we're going to be increasing to 8. So we will have, the flow will be much better with the new. A couple of years ago, our med surg, we call it our East Wing, we gave it a little facelift with new flooring and some new paint, and it made it look a lot nicer. But again, we still have the clutter in the hallways. All of our rooms are have at least 2 beds, some have 4, and not all the rooms have their own bathrooms. So the new plan would allow for that. So we spoke a lot about, Jerry spoke a lot about the focus A, which is building the new tower, the new surgical pavilion. And we'll talk just a little bit about focus area B, which is revitalizing the East Wing. So this would be a renovation of about 14,000 square foot. Give it the modern look and modern feel. It's going to increase the patient safety because the nurses' stations will be centralized to the patients. They'll be able to keep, closer eye on the patients. We will have 24 single patient rooms. Each will have a private bath, and they will all be the same. So every room will look the same. So that will be easier for staff, easier for patients. There's going to be an area for family visiting and an area for private consultation as well. So this is what we've tentatively come up with. Up here on the right is where the current maternity unit is. So if you come down this hall, which is ambulatory surgery currently now, there will be some patient rooms here. All of these will be patient rooms, again, single patient rooms all through here. A nurse's station kind of central. Another nurse's station here with more of the critical patients here. The ICU type patients will be down here where the nurses can watch them very carefully. We'll have a bariatric room, a comfort care room, and multi-purpose consultation room. So, again, we've really achieved a lot. This is where ICU currently is right now, so we just kind of move things to make it, again, so the nurses' stations were more centralized and they could move patients to the appropriate room.
Will there still be a chapel?
Yes.
What is that?
Pardon?
Can you see it on?
No, it's not on here. And this, we have a lot more to do with these. These were kind of just rough drafts from, conceptually what we came up with as some groups, but we do have a lot more tweaks to make to them. So, and again, we're hoping for everybody's feedback here, and we're going to get the staff more involved in the positions again, but that's kind of the first take what we came out with, at least for the grant.
Okay. So, like most initiatives, we eventually get to, the projected budget, or basically you want to see, show me the money, or show you the money, right? So, this is a draft budget, and so the new addition with renovations, we're projecting to be $22 million. Okay, so it's a rough calculation, and then I'll take you into some square footage calculations. So the funding sources, right now we're projecting $16 million. I would not be surprised if between now and March 2nd, when this thing goes off in the mail, that we ask for a bigger number than 16 as we fine tune. But as you know, with most grants, you never ask for the entire amount. You have to demonstrate to the funder the local commitment. So the local commitment, we have undesignated funds at a level of $5 million, and the foundation has endorsed doing a capital campaign for $1 million. So you put all of that together, I think we can get there from here. And so what does it look like? So focus area A right now, without equipment, we're projecting at $400 a square foot at 36,000 square feet to be about $14 million. Focus area B, generally renovations are 85% of new construction. So at 13,700 square feet, it'd be about $5 million. So this part is 19 million, the bricks and mortar. And then right now we're projecting 3 million for new equipment. And this is where I think we have a little more work to do. So, the grant application came out, Joanne, was it 3 weeks ago?
4.
4 weeks ago. So each passing day, we're able to drive more detail into this initiative. So there could be some tweaking between now and that first week of March next week before this is finalized. But I think this is reasonable. This is the ballpark that we're playing in. Okay. I think it's also worth mentioning, is there a local economic impact? And the answer is yes. So the construction multiplier is 1.7. So assuming 22 million is where we land, it would add $37.5 million to the local economy. Ongoing healthcare multiplier is 1.41. So our expense budget right now is about $76 million. So that has an impact of over 107 million in the local economy. So you can see this is not only about how we drive improved patient care and hopefully become a more significant player in physician recruitment. It also is meaningful to the local economy. We are a place where lots of people come to work every single day. So what are the next steps? The grant is due March 14th, but Joanne is quite insistent that we get ahead of March 14th, so we're shooting for next week. It's an online application process. So what we have left to do are fine-tune some of the budget projections at this point and finalize the descriptive paragraphs associated with each question, and that's a pretty involved process. And to be able to talk about why transforming this building in the way outlined earlier, the goals, makes sense for this community at this time. We have access to big data around service lines by zip code where people go for service. And I can tell you there are many services that we could provide here if our facilities were more state-of-the-art, and then those dollars would stay in the local community. So we would create a venue to reinvest in ourselves. So if it all goes according to plan, we submit the application in March. Late June, early July, we'll find out. And once we know that, we're going to spend the rest of the summer and fall having the architectural drawings at such detail we can go out for bids. And so we do that late fall into the winter. And then once the snow melts, be ready to break ground. And based on what I've seen in my first winter, snow doesn't last long here. You saw how much green grass there was outside, right? Some of it's actually turning green. So in 25 minutes, we've talked about, several weeks of work, and we just sort of rambled on. So at this point, do you have questions, things that you think we're not seeing and that we're missing, or general observations about the project?
I'm wondering if is there an elevator to get from like the ER to the OR, or is that something we need to think about, or how would that happen if someone was in the ER and needed to get to the OR?
Yeah, there is an elevator and it's in place right now.
Okay, so it would be the same one?
Same one.
Okay.
Correct. Yep. It's a good question. Somebody who's navigated these hallways. Okay. Do you think good project? Something are we missing anything? It's somewhat limited in scope, right? Surgical services, outpatient services, and then the rehab of East Wing. Revitalizing is the buzzword today instead of renovation. So revitalizing the bedded side of the institution.
If we don't get the 16 million, if they come back with a lower figure, is that a possibility that they could come back with a lower figure? Do we have the funds to match? What's the breaking point?
Yeah, I haven't spent a whole lot of time there. We do have more than the $5 million, but as you know, we never want to completely eliminate our savings. So we would have to step back, and I think depending on what is given to us, if it's much lower than the 16 million, it would probably impact, picking one of the focus areas. I'd rather do one excellently than two, just okay. So I think depending on what that number is would influence if we do focus area A and B or just one. My preference would be focus area A, because I believe we will go from almost 2,000 surgeries to 3,000 surgeries with this. And the way rural hospitals are funded is through surgical output and the ancillary services that are driven by that. And then that would be an important way to drive margin to our bottom line, which would allow us to continue to invest in primary care and be viable and sustainable. So I think that's, if I had to say A and B, which was most important, it would be A. But I also know, the patient experience is driven by two factors, staff and physician communication skills with the patient and the presentation of space. And I would like to, clearly we always need to be attentive to our communication capacity with the patients and their families, but we need a space that's a little more modern than what we have, especially if we're going to drive recruitment of young physicians who will be the next generation of provider. like we've enjoyed here in Lewis County for quite a period of time. We have a core group of primary care physicians who will be leaving us in the next few years. They're retiring. And we don't really have a bench, if you will, to step up once they retire. Younger physicians can work anywhere. And so, I think they will be drawn to life in Lewis County, safe, outstanding schools, good people, good values, good morals, but they also want to be practicing in state-of-the-art facilities. So that's what we're competing with. It's a little more than what you asked, but it's sort of all connected. Yes, sir.
The number, the statistic you came out with, 3,000, go from 2,000 to 3,000 surgeries. Where did you come up with that number?
Yeah, just the improvements that have been made recently. We've gone from 1,600 to nearly 2,000, and we would be going now from 2 ORs to 3 with a procedure room or the endoscopy suite. So we'd be doubling our capacity. And right now we have 3 general surgeons. We have 2 orthopedic surgeons. We'll be adding a 3rd orthopedic surgeon. And there are some specialists who are considering doing some outpatient work in this institution. So it's through all of that coming together with a space that would be able to accommodate all the procedures. So that's how we came up with that number.
Grant application is approximately 80% of the total grant.
Right.
Maybe you could explain how you think we would be able, being such a small portion of the state, be able to grab that much of a grant that is statewide.
We received no transformation dollars last year. Well, many around us did. And I think the state has worked hard to spread these dollars across the state. And but you don't want to count your chickens before they're hatched. I've reached out to our state representatives and senator to keep them informed on the project, and to be hopefully part of helping influence, I guess, a decision that would drive some of those dollars coming to the North Country. But really, I'm cautiously optimistic because we're talking about activities that transform and help sustain local access. And this isn't about debt relief. And last year's application was around debt relief. So the state government doesn't want to send money to Lewis County to help us pay our bills. What they want to do is invest in the organization so that we can sustain local access to health care for the next generation. And I think state government is very sincere on that point.
Jerry, earlier
Yes.
you mentioned maybe some renovation to this sector of the building. Can you describe that a little bit?
Yeah, so that's the trailer, that's the teaser. And there will be another grant coming out later in the summer. When this building was built, it was built as though Lewis County General was a landlord, and we provided space to a lot of private physicians. Over the last 25 years, well, we've gone from landlord to providing health care in this building. There are only a few spaces now that we rent. So when you design a building as a landlord, it's very compartmentalized. But what we really are, as you know, we employ a number of physicians. We're really a multi-specialty group, and in today's environment, you wouldn't have, 8 different entry points into a building to see the specialists. What you would do is have a central receiving point, gaining efficiencies sort of on the administrative side, and creating exam rooms that are standardized across the entire building for efficiency and safety. So through standardization, you drive safety, quality, and efficiency. And so it's not doing anything to the envelope, it's really reconfiguring the internal space and viewing it as one building for a multi-specialty group. So I think there's some real opportunity there. And so there's another grant I've learned of that would be in several $1 million range that would allow us to actually, kind of rehab this space.
I think I'm sort of optimistic because the medical staff has been working on this for a decade and wanting to upgrade our surgical suites. And so when the grant came, we already had an architect, we already had drawings, the medical staff had already worked through exactly what was the minimum amount that we would need. You know, of course, when the architect first comes, they say, don't you want 12 operating rooms and don't you want 24 beds? And we're like, no, this is really what we really need. And I think that thoughtfulness, I'm hoping will impress the state.
And I think in today's world, you know, most surgeries are day surgeries now. And there are very few where you stay here for any length of time after the operation. So that's part of the transformation here. It also drives some of the savings or efficiencies in healthcare. You don't have a lot of bed nights in the institution, and it's the bed night in the acute care facility that drives expense. So it's over $1,000 a day. So you can see if we're not here, if you're not having to spend your nights in here after the procedure, the cost of care is lower. And in this environment of accountable care and being measured not only with regards to quality, satisfaction, but you're being measured against cost. So we have a responsibility to try to drive the cost of care down. This model helps drive that. Okay. So any other questions or thoughts?
Will the new construction have any impact on available parking or the current available parking?
Yeah, we plan on adding parking and reconfiguring the parking that we have. Because I also think there's an opportunity to develop a helicopter pad on this campus so that we're not using up half the fire department and a number of staff here in the EMS service to bring people up to the Climax building so they can be airlifted. So I think, you know, there are actually state resources to do that. And so we're going to be working that as well. But the primary point of your question is parking can be difficult here. And you have to go a long distance, and you're absolutely right about that. So with this plan, there is, I can actually show it to you. Right here, that's the number 3 road. Okay, and there's still some legwork, but imagine if we share the driveway with Rita. Was it? Yes. And then come off that at the base of the tall pine trees. That's where the parking lot would be. And so I think there's an opportunity because of that. We can decompress this parking lot. And so that's the second teaser, I guess, is there's an opportunity to perhaps get the Helo Pad over in that direction. You know, I came from an organization that had a Helo Pad and we didn't pay a nickel for it. And it's an important part of the healthcare delivery system nowadays. So it's just a matter of bringing the right people at the table, having the right drawings, and getting the right funding streams coming down. So obviously that's taken a little bit of a back seat to this project because, you know, this is a higher priority. But yeah, so that would be the parking. Now, some people have suggested we build a parking garage. Now, I'm politically naive a bit, but I know enough never to go to the Board of Legislators with that question. Yes.
Would it be worth thinking ahead about putting a helicopter pad on top of the new building, like putting that in place, whatever standards need to be?
I actually had a conversation with St. Joe's about that maybe six to 8 weeks ago. The requirements of the building to support that would drive this project so that it would be sustainable. Yeah. And it's also a little more dangerous. So, but good question. I like creativity. Jenny?
If you move adult day healthcare, would there be any ability to renovate the cafeteria area space? I know that would cost additional funds, but that's old as well.
Yep. Have you been down recently?
Yes.
How recent?
Last week.
Oh, okay. So you know we're kind of tinkering on the edges, right? I think in the short term, probably not. And the reason for that is it isn't going to drive the patient experience and then ultimately revenue to support access to primary care. However, I do think the areas where staff congregate, meeting rooms, consultation rooms, cafeterias do need to be addressed. I also think we have some rooms in the residential healthcare facility. We need to find some funding to modernize some of those spaces as well. You know, the use of, an example in long-term care now, we're getting to a generation of people in long-term care who are not bath takers, but showers. They take showers. And many of our rooms have bathtubs. So, you know, back in the day, right, that's what people did. But the generation now starting to use these facilities, that's not, nobody wants to sit in the tub anymore. So when I talk about modernizing, that's what I'm talking about, modernizing it for that next group of people who will use those services. Okay. Any other questions? So what do you think? Are we kind of shooting in the directionally, pointing in the right direction? Thumbs up, thumbs down? Okay. Well, thank you for coming. And you know where to find us. If you have any questions, please give us a call. And if you haven't signed the attendance sheet, if you will, so we can track for the purposes of the grant that you were all here tonight. And if you want any other updates, all you need to do is leave me your email, and as this thing moves along, I'd be happy to keep you in the loop. All right, well, thank you everyone for coming.